Good day everyone, I am Catherine T. Canumay from BSN 111B, and today I will be showing you my return demonstration in assessing the cardiovascular system. The cardiovascular system delivers oxygen, nutrients, hormones, and other important substances to cells and organs in the body. It plays an important role in helping the body meet the demands of activity, exercise, and stress. It also helps maintain body temperature and among other things. So prior to the conduct of the assessment, I am going to determine the scope of the assessment, and after that, I am going to review the client's medical record and check the doctor's order for the need to perform the assessment. Now, I am going to prepare the necessary equipment needed to conserve time and energy. So the equipment that I'm going to use first is a pen light to be used as a tangential light source. Next, a rectangular card and a centimeter ruler to measure the patient's jugular venous pressure, sterile gloves, and lastly, we have the stethoscope. Now I'm going to perform proper hand hygiene and observe appropriate infection prevention procedure to deter the spread of microorganisms. For the introductory phase, I am going to introduce myself to the client, verify the client's identity using two identifiers, and ask the client how he would like to be called during the assessment. Also, I'm going to explain the procedure and how they can participate during the assessment. So this is done to reduce the client's anxiety and enhance cooperation. After that, I'm going to ensure the client's comfort, privacy, and confidentiality, and drape the client's body as needed throughout the assessment. So this is done to protect the client's integrity and enhance comfort. Good day, sir. I am Catherine T. Canumay, your student nurse for today. Can I see your wristband, please? Can you state your name?
I am Patrick Anay.
Your birthday?
It's on April 26, 2002.
Okay. And how would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'll be doing a cardiovascular assessment where I am going to assess your heart and your peripheral vessels for any abnormalities. So during the conduct of the assessment, I am going to touch some parts of your body and there are some movements that you should follow. Will that be alright?
Yes, it's alright.
Okay, so do you have any questions or clarifications before we start?
No, none so far.
Okay, so Mr. Patrick, is it okay if I close the curtains for me to provide you with some privacy and away from disturbances?
Yeah, sure.
Okay. How about the room temperature? Are you comfortable with it?
Yes, I'm comfortable with it.
Okay, how about your position right now? Are you comfortable with it?
Yes, I'm good.
Okay. So, Mr. Patrick, all of the information that will be gathered today will remain confidential and will only be used for medical purposes only. Would that be alright?
It's alright.
Okay. So now I'm going to ask the patient if he has an existing or history of cardiovascular problems as well as lifestyle habits that are risk factors for cardiac problems. So now, Mr. Patrick, I'm going to ask you a few questions before we start, okay?
Okay.
Okay, so Mr. Patrick, do you have any specific complaints? Do you feel any pain in your chest or in your lower extremities?
No, but I am experiencing palpitation sometimes.
Okay, I will note that. Okay, so have you experienced any shortness of breath, dizziness, or headaches?
Yes, I feel dizzy along with palpitations.
Okay, so how about any history related to cardiovascular diseases or illnesses?
None.
Okay, so is there any history of hypertension, myocardial infarction, or coronary heart disease that has ever affected the members of your family?
Yes, my grandparents on my father's side have died because of hypertension, and my father was diagnosed with cardiomyopathy last 2 years ago.
Okay, I will note that. So, Mr. Patrick, do you have any vices like smoking cigarettes or drinking alcohol?
No, I don't have any.
Okay, how about coffee?
Yes, I usually take 2 to 3 cups in a single day.
Okay. So, how about the usual activities you do every day?
I play basketball
Mm-hmm.
and I exercise regularly because of our training. And when I feel stressed about something or anything, I usually play video games.
Okay, that's great. So, now we're going to start with your assessment.
Okay.
Now, for assessing the jugular veins, the first thing I am going to do is to stand on the right side of the client and position the client supine with the head of the bed elevated between 30 to 45 degrees while making sure that the head and torso are on the same plane. And then instruct the patient to turn the head slightly to the left and shine light into the neck suprasternal notch, and area around the clavicles to observe for pulsations and shadows. So, Mr. Patrick, I need you to turn your head on your left side, please.
Okay.
Okay. Okay. Okay. Okay. Okay, so if the jugular distension is noted, assess the jugular venous pressure by locating the highest visible point of distension of the internal jugular vein while emphasizing it with tangential lighting, and also, as deemed necessary, raise or lower the head of the bed about 30 to 90 degrees until the highest visible point of distension was observed. So this can be useful in the differentiation of various forms of heart and lung diseases. Okay. Okay. Now I'm going to measure the vertical distance in centimeters above the sternal angle by extending a long rectangular object or a cord horizontally from this point and a centimeter ruler vertically from the sternal angle, making an exact right angle. Okay. Now I'm going to proceed to the other side and repeat the whole procedure. Now, in assessing the carotid arteries, we need to elevate the head of the bed at 30 degrees and then position the client's head slightly towards the side being examined. And then palpate the carotid artery, cautiously avoiding too much pressure or massaging the area. So this is done to avoid obstruction of blood flow. Okay, Mr. Patrick, you have a symmetric pulse volume, which is good.
Okay.
Next, instruct the patient to turn his head slightly away from the side being examined and place the bell of the stethoscope over his carotid artery. Ask the client to hold his breath for a moment and auscultate the carotid artery for bruit. So bruit is an audible vascular sound associated with turbulent blood flow, which is an indication of occlusive arterial disease. So, Mr. Patrick, I need you to tilt your head a little bit.
Okay.
Okay, and then hold your breath for a moment.
Okay.
Okay. The other side. Okay, Mr. Patrick, upon auscultating for your carotid artery, so there is no sound. That is good, okay?
Okay.
So now, in assessing the heart or the precordium, begin with a general inspection of the chest wall. In women, keep the right chest draped. Gently lift the breast with the left hand or ask the women to do this for assistance. And then stand at the right side of the client with the head of the bed elevated at 30 degrees and look for any abnormal pulsation. Shine a tangential light across the chest wall over the cardiac apex to make these movements more visible. So now, Mr. Patrick, I'm going to assess for your chest wall.
Okay.
Okay. Okay, so what I am looking for here is any pulsations, asymmetry of movement, retraction or heaves, or the strong outward thrust of the chest, which you don't have. Okay. Okay, that's good. So now I am going to assess for pulsations in aortic, pulmonary, tricuspid, and apical areas. So first, I am going to palpate for hips and lifts using the palm or whole finger pads flat against the chest. So hips are forceful contractions of the sternum and ribs. Okay, Mr. Patrick, there is no lifts or hips present. That is good. So now I'm going to assess for thrills by pressing the ball of my hand, which is this one, firmly on the chest to check for any buzzing or vibratory sensation that is caused by the underlying turbulent flow. Okay, so there is no thrills present. That is good. Next, palpate the impulses using finger pads flatly or obliquely on the body surface from the aortic, pulmonic, tricuspid, and the apical areas. Then for finer assessment, palpate with one finger alone to confirm the characteristics of the apical impulse, noting for its location, diameter, and amplitude. Okay. 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 So, if unable to palpate the apical impulse, then reposition the patient to roll on his left lateral side and then palpate again. So, Mr. Patrick, I need you to face at your left side, please.
Okay.
Okay. Okay. So, if still unable to palpate, then instruct the patient to exhale fully and then palpate again. So, Mr. Patrick, I need you to inhale and exhale and then hold it for me, okay? Okay, inhale and then exhale and then hold it. Okay. Okay, you can now roll back. Okay. So now I am going to palpate and inspect the epigastric area, which is at the base of the sternum, for any abdominal aortic pulsation. Okay. For the auscultation, assess for heart rate and rhythm by placing the diaphragm of the stethoscope at the apex and listen closely to the heart and rhythm of the apical impulse. Count the heartbeat for a full minute, and if an irregular rhythm was detected, assess for a pulse rate deficit. Okay. Now, using the diaphragm of the stethoscope first and then the bell, auscultate the heart in all four anatomic sites for heart sounds, extra heart sounds, and murmurs. Ask the client to breathe regularly while auscultating. So, Mr. Patrick, I need you to inhale and exhale for me, okay?
Okay.
So first, I am going to auscultate for the aortic area, which is located at the second intercostal space at the right sternal border. So first, I'm going to use the diaphragm of the stethoscope. Okay, Mr. Patrick, inhale and exhale. Okay, and then I'm going to use the bell of the stethoscope. Okay, Mr. Patrick, inhale and exhale again. Okay. Now I'm going to auscultate for the pulmonic area, which is located at the second intercostal space at the left sternal border. Okay, inhale and exhale. Okay. And exhale. Okay. So now I'm going to auscultate for the tricuspid area, which is located at the fourth intercostal space at the left sternal border. Okay, Mr. Patrick, inhale and exhale. Okay, inhale and exhale. Okay. And lastly, for the apical area, which is located at the fifth intercostal space at the mid-clavicular. Okay, inhale and exhale, Mr. Patrick. Okay, again. Okay. Now, repeat the preceding steps when the patient is in his lateral position and when sitting position. Okay, Mr. Patrick, I need you to face at your left side, please.
Okay.
Okay. Okay. Okay, so I need you to inhale and exhale for me and then hold it, okay?
Okay.
Okay, inhale and then exhale and then hold it. Okay, again, inhale and exhale and then hold it. Okay. Inhale and exhale and then hold it. Okay, again, inhale and exhale and then hold it. Okay, inhale and exhale. Okay, inhale and exhale and then hold it. Okay, inhale and exhale and then hold it. Okay, inhale and exhale and then hold it. Okay, you can now roll back, Mr. Patrick. And now I need you to sit. Okay, and then bend a little bit. Okay? So I need you to inhale and exhale and then hold it, okay?
Okay.
Inhale and exhale and then hold it. Okay, again. Okay, inhale and exhale and then hold it. Okay, again. Okay, again. Okay, inhale and exhale. Okay, inhale and exhale and then hold it. Okay, that's good. You now lay back. We are now on the assessment of the peripheral vascular system. First, assess each arm of the client for size, symmetry, skin color, and temperature, from fingertips to shoulders, and then note for any presence of edema, lesions, changes in skin texture, and hair distribution. And then inspect the peripheral veins in the arms for the presence of superficial veins when limbs are dependent and when limbs are elevated. Okay, Mr. Patrick, can I see your hand, please? Okay. Skin is warm to touch. The other hand. Okay. I see that skin color is consistent and hair is equally distributed. That is good. So now I'm looking for any lesions, edema, or any abnormalities, any venous pattern. Okay, which you don't have. Okay, that is good. So now I'm going to assess for the radial pulse. Okay, on the other hand, please. Okay, now I'm going to assess for the ulnar pulse. Okay, on the other hand, please. Okay, and lastly for the brachial pulse. Okay, and the other arm, please. Okay, so Mr. Patrick, your pulses are bilaterally strong and it is graded as 2+, which is normal. Okay?
Okay.
So now I'm going to assess for capillary refill. Okay, on the other hand, please. Okay, color quickly returns to normal, which is good. So now I'm going to perform the Allen test, which is done to assess the patency of the radial and ulnar artery. So now, Mr. Patrick, I need you to close and open your hand as quickly as you can and then squeeze it after, okay?
Okay.
Okay, let's start. Okay, and then squeeze it. Okay, then release. Okay, and then do it again. Okay, and then squeeze it. Okay, and then release. Okay, so now I'm going to proceed to the other side. Okay, Mr. Patrick, the color flashes between 5 to 15 seconds, which means that you have a good blood flow, okay?
Okay.
Okay, Mr. Patrick, now I'm going to assess for your lower extremities, okay?
Okay.
Okay. Okay. Skin is warm to touch. Okay. Hair is equally distributed. Skin color is consistent. Okay. No signs of edema. Okay. Lesions or any venous patterns. That's good. So now I'm going to inspect the calves of the patient for any signs of ulceration, redness, or swelling, or varicosities, okay, which You don't have. Okay, that's good. So now I'm going to inspect for any signs of edema, firmness, or tension on the muscle of the calves of the patient. Okay. So Mr. Patrick, does it hurt if I put any pressure in here?
No.
Okay, that's good. Okay. No presence of edema or any firmness on the muscle. That's good. So now I'm going to assess for the dorsum of the foot for any edema. Okay. Okay. Okay, so there is no edema. That is good. So now I'm going to assess for the pulsations. So first I am going to assess for the femoral pulse. Okay. Okay. Now for the popliteal pulse. Okay. Okay, on the other leg, please. Okay. Now for the dorsalis pedis pulse. Okay, on the other leg, please. Okay, and lastly, for the posterior tibialis pulse. Okay. Okay, so Mr. Patrick, the pulses are equally strong and it has a regular rhythm, okay?
Okay.
Okay. So now I am going to perform the Hovman's test or the dorsiflex test to assess for deep vein thrombosis. Okay. Okay. Please. So now I am going to assess for the capillary refill of the toes. Okay, capillary refill is good. Okay. So now, Mr. Patrick, we are now done with the assessment. So now I'm going to help you with your gown, okay?
Okay.
So now we are going to summarize the information obtained during the working phase and discuss the findings with the client and the possible plans to resolve health concerns if present. Okay, so Mr. Patrick, now I'm going to summarize all of the information that I have gathered, okay?
Okay.
Okay, so first, upon auscultating for your neck, I have heard no swishing or blowing sounds. Pulses are equally strong and rated as 2+, which is normal. No thrills noted, and your jugular venous pressure is at 6 centimeters with the bed elevated at 30 degrees, which is considered normal. Okay? So in assessing for the chest wall of your heart or precordium, chest movement is symmetrical with no retraction, no heaves or thrills. Okay? That's good. Pulsations or vibrations are palpated in the areas of the apex at left sternal border or base. Okay? And your heart rate is 75 beats per minute with irregular rhythm. That's good. So in assessing for your upper and lower extremities, arms are bilaterally symmetrical with minimum variations in size and shape. No abnormalities noted. Okay? Skin is warm to touch. The capillary refill is good. Your pulses are bilaterally strong and has a regular rhythm. Okay? So in performing the Allen test, the result is good. And in examining your legs, there are no abnormalities noted, which is good. So in palpating for your pulses in the lower extremities, all are normal and equally strong and have a regular rhythm. So above all, Mr. Patrick, your cardiovascular system is in normal condition. Okay?
Okay.
Okay. So I highly advise you, Mr. Patrick, to take a rest and continue doing your exercise regularly and eat healthy foods and of course, avoid anything with caffeine. Okay?
Copy.
Okay. So do you have any questions or clarifications?
No, everything's clear.
Okay, so I think that's it, Mr. Patrick. Thank you for your cooperation and have a nice day ahead.
Thank you so much for your service.
Okay. Now that I'm done with the assessment, I'm now going to perform proper hand hygiene and document the findings on the client's record. Okay, so that's it for my return demonstration. I am 𝐬𝐨𝐜𝐿𝐴𝐴𝐵 from BSN 111B. Thank you for watching.